I'm Cynthia Schundel, and I serve as co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Andrea Perdomo Morales,
Present.
Donna Honer Quayle,
Present.
Sarah Behrens, Jasmine Cohen Young, Mary Gill, Mike Gillette. There are a lot of absences today. Leanne Gingery, Yolando Johnson,
Present.
Catherine Reck, Christy Sanders,
Present.
Eric Schonecker,
Present.
and Robin Unruh. I note the following BSRB staff members are also present. David Fye, and is Leslie with us today?
Leslie is available if we need her to log on later,
Okay.
but probably will be just me for this meeting. So.
Okay, thank you. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Cynthia. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On May 12th, 2025, we sent notice to the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allow members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And we did check the conference call line before the meeting began. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Okay, thank you, David. The first item on our agenda is to approve the agenda. And hopefully you all had a chance to look at that. David sent it out yesterday. I would entertain a motion to approve the minutes as presented unless someone has an amendment or a change to suggest.
And Cynthia, at the moment, we are one member shy of being able to take action in terms
including this?
Yes, because you do need a majority of members present to take action. So if it would be okay with you, we could go ahead and move over that item on the agenda and then back to it when we have a quorum.
Okay, hopefully that will happen soon, because the next we were going to reverse the executive director's report and the discussion and recommendation of new advisory committee members. We have two openings because two of our members have served, have decided not to seek reappointment. One has moved out of state, and the other indicated that she just didn't have the bandwidth right now to include this duty. So we do have two openings, and we had 23 applicants for those openings. Hopefully you all had a chance to look through their applications and their resumes so that we can have some discussion and select two to recommend. The chair of the BSRB is the one that will appoint the advisory committee members, but we can recommend the two that we feel would be best suited. However, given that we can't vote at the moment, I'm going to go ahead and suggest that we let David give his report, and hopefully by the time that's done, we'll have a quorum for voting.
Thank you, Cynthia. And I will send a quick message to the members who are currently absent and just see if there's anyone who could attend the meeting at the moment to make sure that we have enough members to discuss the candidates. So let me go ahead and send that quick message, and then I'll start some of the items in my report.
Thank you.
Okay. And like I said, I will keep an eye on the Zoom waiting room, and I am hopeful that we can have another member log in as quickly as possible, so that way we can do that very important item of business for today. So
Okay.
I'll go ahead and start my report. So at every board meeting or advisory committee meeting, I always like to keep the advisory committee members aware of BSRB operations updates, as well as items from the most recent board meeting. So in terms of BSRB updates, one item we've been talking about with the advisory committee, back in the fall, the board reached an agreement with a company called CE Broker, and that is a company that the board is working with to provide a free service to licensees. The board, upon license renewal, we audit 10% of all licensees to ensure compliance with the continuing education requirements for the profession. And in the past, that process has been done by a series of individuals, sending materials back to the board in terms of demonstrating completion of those hours, and then we approve those individuals through the audit process. What CE Broker offers is a free portal for individuals to upload their documentation. They've completed their hours. So if they're selected for audit, we can log into the portal, verify the hours, verify that they're in the correct categories, and then approve the person for audit much quicker. And it's a free service to the BSRB. It's a free service to licensees. There's a free account for everyone. There are some optional paid accounts that offer some additional benefits, and that is how the company essentially makes money, and how they operate, and how they can afford to provide a free service to so many people. And so the board partnered with that company in the fall, and we did make it an optional opt-in for a lot of individuals. So the last group that went live with that was in January of this year. So it's been about 5 months. We're coming up on about 6 months for everyone. And I just wanted to collect a little bit of feedback from anyone who has registered with CE Broker, or if you haven't registered, but you've heard from other associates how CE Broker is going. We have a meeting coming up with some representatives of the company to talk about any issues people are having, or to get an updated count of how many people have signed up and are using CE Broker. So, so if you do have some feedback, I'll just pause here and see if any of you have had, positive experience so far, challenging experience, if there's things that you've heard from other people. That way I can collect this feedback from all of you and then take it into that meeting. So tell me a little bit about your experience with CE Broker so far.
I was just in, I did set up an account, and I was just in there this last week, starting to enter my CEs because I'm going to renew my license here shortly. One thing, the categories that they have for types of CEs, the first one is, things that have been pre-approved by the BSRB. And I wasn't sure about, like, I I have one course that I took through NetCE, and they're approved through ASWB, but I don't know if that makes them automatically approved by BSRB. So that would be entered as one that isn't pre-approved.
Correct. And so in Kansas, there's the official pre-approval process by the BSRB. It's not a requirement, but it's something that providers can choose. But separately, any kind of pre-approval by a different organization would be separate. So we would basically say as long as that class would meet our requirements and the regulations, then it should meet the standard defined. But it's not specifically pre-approved in Kansas unless it's pre-approved by the BSRB, basically.
And anything that ASWB offers is not automatically approved by BSRB?
Correct. I mean, it is most likely to count because if it would meet the regulations, then it would be fine. But there's not a specific thing in the law that says if it's pre-approved by a different organization, then it would automatically be pre-approved in Kansas.
So that piece was a little confusing about knowing how to categorize the CEs that I have to enter. I don't know if there's a way to clarify that specific to Kansas providers.
I ended up getting one of the pay accounts, and I kind of like Cynthia, I did find the uploading things I've already done a little bit tedious. But it wasn't too terrible. And like their offerings online where you can get like the CEs, I thought those were really good. There's a pretty good array of options to get any kind of specific CEUs that you wanted. So, by and large, I thought it was a pretty good system to use, and I was really happy with it.
How expensive were the CEs that you chose, Eric?
So it's an annual fee, and I want to say I paid like $90 for the year or something like that. And you can get unlimited CEs from
Okay.
there. So if you didn't want to do anything other than just go on CE Broker, you could. I managed to get up somewhere in the 80s in a given year, but I needed like one more hour specific to either diagnostics or ethics or something like that. So I took a 6 hour, whatever one of those was. And like I said, if you got all your CEs that way, it would probably be a steal to do it that way. But with the partnering with the BSRB, I thought it was just pretty easy money spent.
Mm-hmm. And you thought the content was good for the courses that you took?
Yeah, I wouldn't say that it was overly challenging to pass the quiz at the end, which I'm okay with. But as far as the content, I thought it was as adequate as any of the other ones I've ever used.
Great. Thank you, Eric.
Thank you
I'm
for the
glad to hear
feedback.
that.
I really appreciate that. Well, I saw that Leanne Gentry has logged in, so she is in attendance slowly.
Yes. Hello, with Leanne.
Hello, sorry about that. My client ran late getting out of the session.
No problem at all. And Yolando, I know you mentioned you would have to log off early. Would you have time to participate in some of the discussion, or will you have to log out here in the next few minutes or so? Sorry, I think you're
You're
muted.
muted.
I'm sorry, I could stay on until about 10:40.
Oh, that's perfect.
Okay. Perfect. That's
Well,
great.
why don't we pause my report and then go directly to the discussion about candidates? I want to make sure you guys have as much time as possible to discuss all of the very talented and qualified people who applied for consideration.
Yes.
So just a quick note about that. As Cynthia mentioned, 2 people are coming off the advisory committee. The advisory committee policy does say you have to have a minimum of 3 non-board members, a maximum of 10. So you could recommend either 1 or 2 people to fill the open positions that are coming up. The advisory committee policy does give some direction in terms of what to weigh when looking at candidates, but I'll turn it over to all of you. I want you to have as much time as possible to discuss the applicants. Also, in your message that we sent out, we asked you to come to the meeting ready to discuss the top 2 or 3 people that stood out to you the most that you thought would be good additions to the advisory committee. So if there's a consensus, that will work. If you need to take a formal vote, you could do that as well. So you have some flexibility here. But I'll turn it back over to Cynthia.
Okay, thank you. It was a lot of resumes to read through. I hope you all had a chance to at least take a look at those. Did you all come up with three that you felt like were your top choices? I thought we could just go through the names and see and tally how many votes for each person, and then take the top five vote getters and discuss those in more depth. Does that sound like a acceptable way to try to parse through all of these? Anyone have a different idea? Okay, well, I'm just going to start at the beginning then from the first uh, of the three emails that David sent us with the resumes. And the first person listed was Annis Boyer from Lawrence, Director of Youth Community Services at Burt Nash, also in private practice. Was Annis on anyone's top three list?
She was on mine. She was an instructional professor at the University of Kansas when I went through and got my master's degree, and I found her knowledge, particularly in the area of substance use, but with clients with diverse backgrounds, to be incredibly informative. She was pretty high energy, and I really liked her, so she would probably be my number one candidate.
Okay, great. And
She would be mine
Christy,
as well.
Leanne as well, and
Yeah.
also Christy,
Yes.
right?
And
Great.
I had her as well on technically it's my top
Andrea?
8.
Top 8. That's great. Did anyone else have her as a professor, or you know her other ways, or just by her resume? Okay, that's good intel, Eric. Thank you. Um, okay, so there are 4 votes for Annis. Then the next one is Dawn Harriet, who is from Topeka, case manager at the Kansas Rehab Hospital. Anyone have Dawn on your top 3 list?
I had Dawn on my top 8.
Top
And
8,
that doesn't-
okay. All
I
right,
had Don also in the 5.
okay. So 2 votes for Dawn. Do either of you know her, or were you just going by her resume?
I don't know her.
Okay.
As a matter of fact, I don't know anyone. I found it challenging to go
Yeah, me
through.
too.
Everybody seemed qualified. I don't know. But I was just kind of looking at the experience, their titles, not their titles, but their credentials.
Mhm.
And that's basically what I went by.
Okay. All right. So 2 votes for Dawn. So third one is Audra Kennison from Wichita. She is an LMSW, which there were only a couple that were LMSWs versus LSCSWs. She works for Rainbow United. She's the mental health coordinator. It appears to be an adoption agency. They work with children birth to 5, and she taught at Butler Community College. Anyone have Audra on your list? No? Okay. Then we have Angie Anault Logan, who is an LSCSW, works at KU Med in the psychiatry department. She's all but dissertation at KU, or all at KU towards her PhD. And she's located in Lawrence.
She was in
Anybody
my
have-
top 3.
She was in your top 3, Christy? Okay.
She was in my top 5, but just
Okay.
based purely on credentials.
Okay. And did you know her, Christy, or also based on
No, I don't know any
the
of these.
resume? Okay.
But I like, I was just looking for diversity, and it's really hard because I don't necessarily know the backgrounds of everybody on the committee, but she has her license in several states, and
Yes.
if ever needed a different perspective or what it's like somewhere else.
Mhm.
And she was on my list also.
Okay. Oh, so that's 3. Okay. And she's there. So that's 2 of them from Lawrence, 1 from Topeka. Okay. And then we have Eric Martin from Manhattan, LSCSW and LCAC. Recovery Service Manager at Pawnee Mental Health, has also been an instructor at K-State from Manhattan. Anybody have Eric on your list?
I have him on my list.
Okay.
I also liked Eric. I would guess he was somewhere in my top 10.
Okay. All right. Well, we'll put another check mark by his name. Next is Jordan Mayfield, also from Lawrence. And Jordan is an LCSW and LCAC and is dually licensed in Oklahoma. This was a person who, if you read through his letter, he believed that the BSRB was a year behind in our complaints, which, David, can you elaborate on that a little bit? You and I talked about that, about why he might have thought that.
Well, we do see an increase in complaints, and we have over the years. They are increasing. But basically, we work on those in the order that we receive them. And given the complexity, there's a lot of factors that go into it. So it's not that cases are just not being worked on. It's that sometimes there are more complex issues. And there are some cases where we receive some information and then additional information is received or more allegations come in that have to be investigated. And there's some other, legal reasons why certain things just take more time. So some cases I think we've had that we can dismiss within the first month that we receive them, some that do take some lengthy amount of time. So it just kind of comes down to everyone has a different experience with some of this, but kind of wanted to assure you that we are trying to work on these as quickly as possible while also kind of, knowing that we have a couple investigators here in the office and we usually get about 200 complaints over the course of the year. So a lot of them are somewhere in the process of being investigated, collecting information, going to the complaint review committee. And then if there's a decision, our legal counsel takes care of the orders for that. So just wanted to clarify some of that information, but that's the process we follow.
Do we have any complaints that have gone a year because of those complexities and additional allegations or whatever?
Right. And sometimes that does happen. It gets complicated sometimes. When we get something where we have an initial allegation and then we collect more information and then some more things are submitted, or potentially, it might involve something in another state. So we need to collect information from the other state. So there are really complex issues. But the majority of them, we did some analysis for the BSRB recently, and we provided some time frames. And so the average length of time for those that we've been able to resolve is much less, but there are a few outlier cases that can take longer.
Okay. All right. So anybody have Jordan on their list? Jordan Mayfield from Lawrence? No. Okay. Next one's Jay Mueller, who is also an LCSW and LCAC. Jay is semi-retired, 46 years in practice, also in private practice, and has worked at Florence, was the EAP coordinator at Florence Crittenden, behavioral health supervisor at Family Services, long history as a clinician. Anyone have Jay Mueller on your list from Topeka? Nope. Okay. Next would be Jessica O'Flanagan, another LMSW. She's a school social worker in Newton, Kansas. She's a recent graduate, 2021. Her being from Newton makes her, gives her that a little bit of difference in terms of, that makes her stand out, because most of our applicants are from the Kansas City, Lawrence, Manhattan area. Anyone have Jessica on your list?
She was on mine.
I'd say she was on my top 5 too, and primarily just for the purposes of being more diverse and having LMSWs on the crew.
Yes. Yeah. So 2 for Jessica. Okay, next is Rachel Tittle. She's also an LMSW, and she is at KU Med as a social worker, has a history working at hospice, and she's from Lenexa. and also a recent grad, like 23. So she's just a couple years out of the chute. Anyone have Rachel on your list? Okay. Then we have another Manhattanite, Amy Wessinger Lewis, also an LMSW and an LMAC, Washburn grad. From her resume, it looked like she hasn't worked in the field for a number of years, but she has a history of having been a crisis counselor at Burt Nash and also worked in juvenile corrections and was at Vallejo as a crisis co-responder in the past. Anyone have Amy on your list? Okay. Next would be Callie Work, WERK, also an LMSW. She's a therapist at Western Kansas Therapy Association and also a school counselor. And she's from Hayes. So again, a little bit of geographic diversity. Might recommend her. Anyone have Callie on your list?
I do have Callie on my list, and I have her last name as WERTH.
Correct. That's what I.
Okay, sorry.
Okay, and she's on my. This is Lee. She's on my list as well.
Okay, and she was on mine again, largely because of.
She was another one of my top, probably 6 or 7.
Okay. For me, it was because LMSW and the geographic diversity, I think, is important to try to have people from all across the state if we can. Okay, Christina Brown, LMSW, LAC, and LPN. Currently working on her doctorate at KU. And also is an Army vet. She's in Junction City. Anyone have Christine on your list?
I haven't on my list.
And that was Christine Brown, I'm sorry.
Yes, Christine Brown.
Yes, she was on mine.
Okay, we got 2 votes for her.
She's on mine as well.
Oh, Leanne.
Lee.
Okay. 3. Okay, next is Delissa Cooper, LSCSW. She's in Kansas City, Kansas, and she owns a counseling practice, Thrive Restorative Services, and she's also a young adult team leader at Johnson County Mental Health.
She was on mine.
Okay. Delissa Cooper. Anybody else? Okay. Next is Ashley, is it Earl, EARLL, I believe, LSCSW. She got her MSW in Dubuque, Iowa, and she works at Archway Psychotherapy in Olathe, but she lives in Lawrence, apparently. Anyone have Ashley on your list? No? Okay. Next, we have Heather Heigert, LSCSW from Manhattan. She's a KU grad, and she is a clinical director of Corser Lapo Clinical and Family Services in Manhattan. Has a history working in juvenile intake and school social work. Anyone have Heather on your list? Nope. Okay. Next we have David Irwin from Lee. He lives in Lee Summit, Missouri, but he's the director of the Kansas Outpatient Services, which is part of Cornerstones of Care. History as a therapist at Ozanam, and he actually spent some time as a social worker in London, which was kind of an interesting background. Anyone have David on your list? He was on mine. Anybody else? Okay.
I was hitting the wrong button. This is Lee. He's on mine as well.
Okay. 2 votes for David. So then we have April Lemon, LSCSW, and she's triply licensed in Oklahoma and Missouri, as well as Kansas. She's the director of the Behavioral Health Community Health Center of Southeast Kansas. So again, we have some geographic diversity there. She's in Pittsburgh. Anyone have April on your list?
Yes, she was on my list.
She was on yours, Christy?
Mhm.
Anyone else?
I have her on my list.
Okay. Thank you, Yolanda.
Mine as well, Cynthia.
Oh, and Andrea. Okay. Great. Now we have Heather McGann, who is an MSW, LSCSW. She got her master's at Washburn. She is an inpatient clinical supervisor at Stormont Vale in Topeka. History of working, she did her internship or her practicum at the VA. Anyone have Heather on your list? Okay. Next, we have Ashley Phillips of Leavenworth. She got her master's at Park University. She is the chief clinical officer at the Guidance Center. And interestingly, we had two applicants from the Guidance Center. The other one was Rachel Wolf, who is the clinical training director. I don't know if they both know that they both applied for a slot here or not, but Ashley has a history as program director at Gilda's Club, which is cancer care for women with breast cancer. And she founded a therapy service where she currently has a private practice in addition to her duties at the Guidance Center. She has served on the KNESW board, not currently serving, but has served. And as we've been trying to bridge with KNESW, we've been trying to create some collaboration between BSRB and KNSW. I thought that was something that recommended her, as well as being in Leavenworth. So again, a little bit of geographic diversity there. So she was on my list. Anyone else? Nope. Okay. Okay, Teresa Taylor Williams, LMSW. She is a very recent grad, 24, from Washburn. She lives in Emporia but works in Topeka. She's a hospice medical social worker at Phoenix Home Care and Hospice in Topeka, and has worked as an addictions counselor at Mirror Inc. in the past, and a senior aging specialist the North Central Flint Hills Area Agency on Aging. Anyone have Teresa Taylor Williams on your list? No? Okay. Back to Lawrence with Alexis Whipple, LMSW, a support services director at Van Gogh Inc., and a history as a hospice and hospital social worker. Anyone have Alexis on your list? Okay. Back to Leavenworth again with Rachel Wolf from the Guidance Center. She's the clinical training director, LSCSW LCAC. Has a history as a program administrator at Vallejo in the crisis and intake area, and had been an ER social worker, and also worked at Burt Nash as a crisis assessment specialist. Anyone have Rachel on your list? No. Okay, and the last one is Coralie Scherer, Scherer. She's the one that submitted a few days late her letter of interest and resume. David sent it out to us yesterday. She is an embedded clinician at KU, serving, I believe, faculty and students at KU. And she has a history as a treatment recovery counselor at Burt Nash and a crisis counselor at Headquarters, Kansas, which was the suicide hotline. Also worked at the Lilac Center briefly. Anyone have Carly on your list? Okay. That was all 23. And I think it's pretty awesome that we had this accomplished a group that of applicants to choose from. It really speaks to our social work pool across the state. So I'm looking at my list and the tallies, and if I go with anybody who got 2 or more, we have 9 that we can pare down from. There were a couple that only got 1 vote, but there were 9 that had 2 or more. So there are 2 of them that had 4 votes. That was the most that anyone got. That was Annis and Callie Worth. So I guess what we can do is go through the 9 and have everyone choose 2. Will that get us where we need to go?
Yeah, sounds like a good plan.
See who gets the most votes this time out of those 9 that we selected. So the first one is Annis Boyer, Director of Youth Community Services at Burt Nash. How many would choose her as one of your 2?
This is Lee. I choose her.
Lee and Eric,
I would.
Christy, anyone else?
Mhm.
3.
I would.
And you would too, Yolando?
Yes.
And Andrea, did you say you as well?
Yes.
Okay, so that's 5.
David, were you going to say something?
No, I just I saw Yolando had mentioned something. I want to make sure that we had her
It
name.
got tallied, right?
Cynthia, I'm so sorry. Would you mind saying who the top 9 are real
Sure.
quick?
Yeah, I'm sorry, I should have done that. Yes, okay, so Annis Boyer, Dawn Harriet, Angie Anault Logan, Eric Martin, Jessica O'Flanagan, Callie Worth, Christine Brown, David Irwin, and April Lemon. Those are the 9 that got 2 or more votes in our tally here. So we started with Annis Boyd. Next would be Dawn Harriet. And let's see where, just to it's this one, where's Dawn? Oh, Dawn is a case manager at the Kansas Rehab Hospital, former hospital social work manager at Stormont Vale, and also licensed in Illinois. She's in Topeka. So how many would choose Dawn as one of your 2? Anybody? Okay. Next would be Angie Anault Logan, and she's in the psych department at KU Med and all but dissertation at KU in the doctoral program. In Lawrence, has been an instructor at JUCO. So how many would choose Angie Anault Logan as one of your 2?
I would.
Christy, I'm sorry. Anyone else? Okay.
I'm sorry, Cynthia, I'm gonna have to step off, but
Do you want to? April would be your other choice.
And Eric.
April. Okay, Eric. We just were. It was next, right? Or Eric, and then April. Okay, I have tallied that. So thank you for those votes, and
Thank you.
Thank you for being
before
here.
you hop off, if you had to choose 2 out of those 3 people, who would they be? Because I think you voted for Annis as well. So
April and Eric.
So
okay.
So not Annis, then take
No,
Annis off. Okay.
Those, yeah. If it came down to 2.
Okay. Right, because we have 2 slots. Okay.
Bye.
Right. Thanks for coming. See you next time. Okay, we were at Eric Martin, and Yolando voted for him. Is anyone else have him as one of your 2? Okay. Next was Jessica O'Flanagan, who is a school social worker, LMSW from Newton, Kansas. How many would have her as one of your two? Okay. Next is Callie Worth. And Callie, let me find my notes about her. She's an LMSW also, therapist at Western Kansas Therapy Associates and a school counselor from Hayes. Callie
She
Worth.
was my number two.
Okay.
I will pick her as well.
I would also put her on my list. Anyone else? Leanne? Did you say yes?
Yes, I did.
Okay, great. Thank you. And then we have Christina Brown. And Christina Brown, I'm looking for my notes about her. There she is. Also an LMSW and an LAC in Junction City, working on her doctorate at KU right now. Christina Brown. Anyone choose her as one of your two? Nope. Okay. The next one would be David Irwin. David is the director of the Kansas Outpatient Services through Cornerstones of Care and was a therapist at Ozanam. He's from Lee's Summit. And anyone choose David, I would pick him as my one of my two. Anyone else? Okay. Last would be April Lemon that we talked about. Where is it? April is an LSCSW, the director of behavioral health at the Community Health Center of Southeast Kansas in Pittsburgh. So how many would choose April as your second? Did everybody vote twice? Okay. Our two winners then would, I'm sorry.
I just need to say something because my husband has called me about 1,000,000 times because he's in a meeting and needs information.
Okay.
So I have not voted and I don't want to since I missed out on most of that. So I just want you to know why I've been quiet.
I understand.
Okay.
6, 7, but I think we need your vote though to be, because we need 7.
Well, and actually, Donna would constitute a quorum. So just because she's here and present, and we have Yolanda's vote, so we do have a quorum in terms of individuals that we need for there to be action. So that would be sufficient because Yolanda had already cast her votes.
Right, but Yolanda was number 7.
Correct. Yeah, we just need 7 for quorum, and so that's a sufficient number for quorum.
But don't all 7 have to vote?
No, you just need to be present.
You can abstain. Okay.
Been part of the voting process, so yeah.
Okay, well, it looks like then Callie Worth and Annis Boyd are our two selections for joining the Social Work Advisory Committee. Thank you all for attending to all of those resumes and helping select. We will make those recommendations to the chair of the BSRB, and then usually there's not any question about that, and those people will be appointed, and we will.
Thank you, Cynthia.
Yeah.
And out of curiosity, who was the third runner-up?
Well, interestingly, the other ones that got votes only got 1 vote.
Oh, okay. Okay.
So Angie, Eric Martin, David Irwin, and April Lemon all got 1 vote. So
if you wanted my third runner up, it would have been Eric.
Yeah, and that would have made 2 votes for him. So it still would have ended up with Annis and Callie. I do feel like Eric, you're our token male on this committee. So I would have liked for us to have brought another male social worker on board, but I think we'll do very well with Callie and Annis. So, okay, let's return now to David's report that we interrupted briefly to do that business.
No problem. Very, very important task, and really do value the work of the advisory committees and the advisory committee members. And it is especially challenging process because there are a number of really, really good applicants, and with only 2 open spots, there are some hard choices that need to be made, but really do appreciate all of you that are serving on the advisory committee. And I will summarize the recommendations of the advisory committee and then have those provided to the chair of the board for review. And then the chair can have any kind of comment with the chairs of the advisory committees if they have questions.
And David, sorry to interrupt you. Cynthia, we still have Mike Gillette for 1 more year.
I think that's correct.
Yeah, next year.
26 we'll lose Leanne and Mike and Rob and Unruh. All have 1 year left. So we'll be doing this again next year. That we'll have 3 openings. So okay, David.
Well, I appreciate your feedback on CE Broker, and I will take that to the meeting, and we can continue to help see if we can work out anything as far as making that process smoother, and we'll bring back some numbers in terms of how many people have signed up for it. We don't want to, be a nuisance, but it is a nice service, and we think it really will be helpful for people. It just may be tricky at the beginning to kind of do a lot of the uploading, but we really think it'll be a nice partnership. So,
Hey, David, I did have one additional piece of feedback if you wanted to give CE Broker. It would be nice if they had like a group ability. Like a lot of the other ones, you can actually put your whole practice group into one and sort of make a group policy. And it would be nice if CE Broker offered that for like group practices.
Okay.
I was just going to note also that NetCE offers an annual $89 unlimited CE option as well. So that's competitive. You said it was $90, right, Eric? For the
Yeah,
CE
it was
for a
right
year.
around $90.
Yeah. So that's definitely competitive price with at least with NetCE, which is a similar provider. Sounds like CE Broker might have more offerings though than NetCE does. So definitely worth checking out.
Well, I will continue to bring back information on CE Broker, and I'll let you know how things go for the next step of our process. So, another thing I wanted you to know, there's a couple of things that are going on behind the scenes that you may not really see until maybe a year out or a year and a half out. We're currently working to switch our licensing system to the state's agreement they have with a company called Acela. They passed a bill about a year ago that created an enterprise licensing system for any state agencies that wanted to move that direction. And so we are about the 7th in line, and we have been having lots of meetings with representatives from Office of Information Technology Services. They've been reviewing all of our forms for the 7 professions that we regulate and trying to understand our processes and what information we collect and how we do things, because they're going to be building an automated process for those things. So once we switch to the new licensing system, there will be a way for people to apply electronically. We've been doing renewals electronically for quite a while, but we've been wanting to move this direction for our initial applications, and so that'll be part of the new system. It'll also integrate payments along with the process, and so it'll just provide us a number of new features, and we think it'll be more user-friendly, and on our end, it'll help integrate a lot of things that we are doing separately, so it should make the process even faster when people apply for licensure. So looking forward to that. They estimated probably about another year and a half or so before we go live, just because of where we're at in the process and the agencies that are ahead of us. But the first agency that has gone live with their system is the Real Estate Commission, and a few others are getting close to going live as well. So excited to be in that process. And then behind the scenes here, in addition to working on the licensing system, we're trying to make a shift in terms of how we are retaining records and storing information. We have had retention schedules that have been based on a paper system, and we are trying to move to an electronic records process. But if you've ever done that with a company, it's a very difficult and tricky process to to make that jump, but we are working with the Historical Society to get permission to adjust our document retention schedules for both our licensing files and also our investigation and discipline files. And then we're going to try to make a push to get approval to save those documents electronically. And there's different checks in place as far as having appropriate backups and having off-site things. So there are requirements to make sure that everything would still be, saved appropriately, but it would create some additional space here in our office for us, and we would be able to have staff locate information electronically. And with the new system, we'd be able to upload things in that system in a clean way. So you may not see very much of this from the outside, but behind the scenes, there's a lot of work being done just to update our processes and move more toward what I would consider to be sort of best practices for operating in terms of licensing boards. Moving next to some updates from board meetings. The last full board meeting took place in May, and I believe that was on May 12th. And one of the items the board is working on that I think is of interest to all the advisory committees, you did a lot of really important work in reviewing your unprofessional conduct regulations and providing good recommended changes. You also had the opportunity to review the recommended changes from all the other advisory committees and then make further changes. And so all of those recommended changes were forwarded to the board. The board had a big packet of material in terms of all that language. But to further assist the board, I worked with members of my staff and we created a giant grid that puts each of the unprofessional conduct regulations side by side with similar or the same recommendation regulations for the other professions. So for things like undue influence and dual relationships and confidentiality, you can see the language across the different professions. And the board right now at the meetings is dedicating a certain amount of time at each meeting to go item by item and decide if they want to have consistent language across the professions or whether it makes sense to have some unique language given the differences in professions. There's also some instances where one profession may have an item that the other professions don't. And so the board is making a decision about if that should be included for other professions as well. So it is a process that does take time. And I know that we've been working on this process for a couple years, but some of these regulations had not been updated in over 20 years. And so I think when this process is done, we'll have a really nice set of regulations that are more easy for licensees and members of the public to understand. And I think they will be updated and language will be in the appropriate sense that everything will be looking a lot nicer and we'll have better regulations in this area, which is a really important area for the board's mission of public protection. So just wanted to let you know where that's at for the board. In terms of other events, the board is going to be having its annual out-of-town board meeting that will be coming up at the end of September. And the board has decided to hold that meeting in Manhattan, Kansas. So we do try to move that meeting around the state. It is an all-day meeting off-site. And given the logistics, we really can't stream that meeting like we can the meetings that are held here at the BSRB office, but it is open to the public. So if any individuals want to attend that meeting, it will be September 29th in Manhattan, Kansas. We'll have more information about the specific location of that once we get agreements in place with the hotel and the conference room for that. But that will be open to the public. It'll be all day on Monday, September 29th. So with that, I'll go ahead and end my report and see if there's any questions over the items that I discussed or any other items.
David, I have a question. I've had a couple people ask me about the interstate compact license and where that was, and I haven't heard about it in the last couple meetings.
Thank you for bringing that up. Yes, and I'll try to provide a few more updates on that as we go forward. So what has happened so far, the bill passed that officially added Kansas to the compact. And there is a process which each state basically has a delegate, they call them commissioners, and those commissioners meet to set up the commission. And so there has been, I believe, 2 official meetings of the Compact Commission so far. And I am the commissioner for Kansas. And we have basically gone item by item and voted to approve bylaws for the commission. The next step is really making operating rules for the commission. So there's a number of committees that are meeting. I actually am serving on 2 different committees. I'm part of the Rules Committee and also part of the Finance Committee. So the Rules Committee will go through and look at all of the model language for the compact. And if there's anything that basically was delegated in the model or the model language to the Compact Commission to clarify, such as which licensing examination is appropriate to have passed for certain levels of licensing, or other requirements in terms of compact membership. The Rules Committee is going item by item and making sure those are all voted on. In terms of the Finance Committee, right now, we're trying to work on a which sort of data system the compact is going to use. Once these multi-state licenses are set up, they will need a system to track who's practicing under a multi-state license in every state. And so to house all that information, you need a data system unique to the compact. And so right now, where that process is they are, the commission is meeting to look at other data systems that are being used by compacts to see if we can piggyback with other ones or if there should be a separate one. If there is a separate one, that would need an RFP to go out and vendors would need to apply for that. If there is a way and it makes sense to use one of the existing ones, there would still need to be certain things built specifically for the social work compacts. So, so the data system is one of the things that's probably going to take the most amount of time to build. In terms of the other items, the commission right now is being funded through a temporary grant. One of the individual members of the commission, there are representatives from a few different associations, like the National Association of Social Workers, the Association of Social Work Boards, and then there's a few other organizations that were part of the drafting of the language. And they have been able, representatives from ASWB have been able to obtain a grant at a federal level that has been helpful in terms of some of the initial funding of the support from the Council for State Government, in terms of having these meetings take place, providing legal counsel, and getting the leadership set up for the commission. However, that's not a sustainable funding source. It's only going to last for about 5 years. And so for things to move forward, there needs to be some decisions about how the commission is going to be funded as well. One of the things about this compact, the way it's all set up, is with the multi-state license, some of the other compacts have said, if you get a privileged practice at that time, we will charge a fee, and that fee will go back to the compact commission to essentially fund their operations, maybe an executive director, maybe some staffing, maybe some different things like that. And so that's one of the things the compact commission needs to determine as well, is how they're going to fund the commission long-term. So that's kind of where we're at. The big important decision, I think, will be the data system. And then once that decision is made, it'll be a little clearer going forward in terms of a timeline of how long it will take to build in the different things for the social work profession. Right now, the model language does say the compact would allow a multi-state license for bachelor's, master's, and clinical, but states have different requirements right now in terms of how people have been able to get those licenses in different states. So some of the mechanics behind the scenes is also looking at some of the states and saying, okay, you know, there's at least a couple states that allow someone to get a clinical level license if they take either the clinical level licensing examination or the advanced generalist licensing examination. And so part of the compact responsibilities are to name which tests are appropriate for which levels of licensing. And so there's just a lot of little steps that are being done. But in terms of, I think the big question, when will the compact be operational? I would guess we're still probably a year away, but the biggest reason for that is the data system. I think once we get a decision on the data system, there will be a certain amount of time to determine what needs to go into the data system, and then it will need to be built, and then it will need to be tested, and then it will go live. So that's what I think is the big thing right now, is that data system.
Is the grant going to cover the cost of the data system?
Well, I'm not sure that it will cover that. And I know that there are some groups that are also providing some supplemental funding as well. there may be sufficient funding to create the data system. The ongoing maintenance cost is probably something that will need to be passed on going forward. I don't think that's something that will just, there will need to be some kind of ongoing cost. But I'm hopeful that the initial build of the system will be something that can be covered by the grants or the funding from the association that we're really interested in making sure this gets set up. I think probably whatever fee is passed on to the states or to licensees is probably going to go more towards the ongoing maintenance of the data system and then any expenses for the commission. I know a lot of people are excited about the compact. I am as well. Really interested in having it be operating as soon as possible. I think one thing that is different about this compact compared to, let's say, the SIPAC compact for psychologists. When Kansas joined that commission by passing the legislation, it had already existed for a few years. And so they had had the opportunity to make a lot of those entry-level decisions. For the social work compact, we were the 7th state to pass the legislation. And in the model language, that was the minimum number of states needed for the commission to actually start to exist. So we got in basically almost at the ground floor. And so that's why it's going to take a little bit longer to get it all operational. But we are interested in having it be operational as soon as possible.
Are they looking at how the psych compact was built?
Yes.
I mean, are they looking at that as a template, or are they recreating the wheel?
Well, the problem is they're set up a little differently. SIPAC was focused primarily at allowing telehealth while you are in your home state. And so you actually apply to the SIPAC commission, and you have to have a home state license. And then the primary focus of SIPAC was to do telehealth, but if you're outside of your home state, you're not able to practice under the compact. There is also a limited amount of days you can seek 30 days of in-state practice in other compact states, but that's sort of separate from the main SIPAC thing. There's two different options. Most people do the telehealth option. For the social work model, it is more closer to the Board of Nursing, the multi-state license concept. And so as opposed to it being limited to something like telehealth, once the compact is fully operational, you would be able to get a multi-state license, which would allow you to practice in your home state and all other compact states.
In any way, telehealth or in person.
In any way. If someone traveled outside the state, you could do remote services to them as long as they're in a compact state. If you were traveling and as long as you were in a compact state and you had a license in Kansas, you would be able to do telehealth in any compact state. It's kind of like a driver's license. And that's why there's hope that all of the states, or at least almost all of the states, will pass the compact, because then you can freely move around and clients can freely move around.
Okay.
So excited about it, but we're still probably a little ways out. Once we get close, I guess there's also a step 2 for Kansas and some other states that don't currently have a requirement for a background check for licensure. The compact does require that there have been a background check as part of the licensure process to be able to practice under the compact. So as we are going through this process, we will need to modify our rules to make sure that we're in compliance. So that way our licensees are eligible for the multi-state license. So it will mean that social workers, at least wanting to practice under the compact, will need to have done the background check. It is possible that we may need to move all social workers to have the background check as a requirement, but that is consistent with some of the other compacts. It seems like that is a standard feature for the compact. SIPAC, we have a requirement. We have to move that direction as well for psychologists. For professional counseling, that's also a requirement. We have to move forward at least for the clinical professional counselors. So that background check requirement is fairly consistently a requirement in other states. I think we're somewhat unique in that we haven't had it as a requirement for licensure in the past, but I think we will need to move that direction sometime in the future.
So that will be, you're saying that all licensees in the state of Kansas will have to have a background check, not just those who want the interstate compact?
That's the decision the board will have to make. Under the compact, it says anyone practicing under the compact would have to have the background check requirement. So of course, the compact language, but it may make sense based on other factors for the board to potentially move that direction, given that we have so many other compacts that are starting that are all requiring the background check. So it's something the board will have to weigh in on and consider. But as I look at license requirements in a lot of other states, I think that background check requirement is something that we see in a lot of other states fairly consistently. So I do think it's something the board will have to consider whether to do it just for the people with the who want to practice under the compact, or whether it should be something across the board for everyone.
Okay. Thank you.
Any other questions? I will try to put it as a note in future meetings and just provide some routine updates on the work of the commission. I can tell you in terms of my role on those committees, we are meeting about once a month. And so most of those are pretty much all remote meetings, but we're making sure that we are knocking some of these items out, but it does take a bit of time. And those are open to the public. So if anyone would want to attend those meetings remotely, you can go to the Social Work Commission or Compact Commission website, and there should be some information there in terms of the dates and times of meetings if you want to attend any of those committee meetings.
Do you have anything else on with your report, David?
Nope, that's all that I have.
Okay, that's great. Thank you. And I want to back up now that, we don't have 7 of us. So to approve the agenda and the minutes, I guess we'll have to.
Yeah, we can pass over those until the next meeting.
Until the next meeting, yeah, okay. No quorum.
And I apologize, Cynthia. I did want to highlight just a couple items I included in my packet of material. I put these under my report, just trying kind of to highlight them. ASWB, the Association of Social Work Boards, they basically provide assistance to regulatory boards that license social workers in different states. And they did a social work census last year. You may recall there was a call to fill out that information as they are building the next version of the social work examination. They're trying to get a better understanding of what social workers are doing out in the field so that they can do the practice analysis and different things like that. And so, so now the census was completed last year, and they have put out a couple documents that individuals can review. In your packet of material, I included a lengthy document called the 2024 Analysis of the Practice of Social Work Final Report. It was dated December 30th of 2024, and it is 131 pages long. So I didn't expect you to read this prior to this meeting. I just want you to know that it includes some really interesting information on the practice analysis and some of the information that they were able to learn from the survey. So feel free to take a look at that between this meeting and the next meeting, and we can have just a short conversation on it at a future meeting. There's also been some questions about the changes to the examination. And so I had an article from ASWB from late February where they had discussed a few of the different approaches to the examination and some of the changes to the content. And so I did want you to get some information on that as well. So feel free to review that. I just wanted to highlight that they are in your material. We can talk about them at another meeting after you've had a chance to look over those and think about them a little bit.
And I would just make a note on the census that was done by ASWB that was reported on at the ASWB meeting in Portland that David and I attended first weekend in May. And it's robust data about the practice of social work across the country. And one of the things that stood out the most to me was that the federal numbers for social workers do not include private practitioners. They only include social workers that are employed in agencies, public agencies. So the number that the government says there are of social workers in the country is about half of what they came up with this social work census. And they had very good response. I think, did she say, was it like 30 some percent, 40%, David?
I don't recall the number.
They had a robust response to the survey, and there's also the average salary for social workers. Again, the federal numbers are based on social workers who are employed in public agencies, and so it's much lower than the average when you add in social workers who are in private practice. So that's just one of the points in the in that document. It's lengthy, but I think it's really worth looking at because that data can drive decisions about the practice of social work going forward, to have more accurate data about what social workers are actually doing. And it also points to additional information that needs to be gathered. Like, for example, we have people that are practicing in multiple states, so they're going to show up as licensed in 2 different states on their list of licensed social workers. But how much do they practice in this state versus that state, to get an accurate picture of how many social work hours are actually being worked in each state? We need to, there's going to need to be additional fine-tuned data. So very interesting. And the researcher was very enthusiastic about her work and presenting her data. So I encourage you to take a look at that. Okay. Moving on to our old business, we have a continued review and update of our social work supervision manual, and that was forwarded to you in yesterday's email, I believe. This is something that Eric and I started working on, gosh, probably a year ago, huh, Eric? It has been revised. We started with what was already there, a supervision manual that was basically covered the regulations and the requirements, but we wanted to add kind of a how-to component, template for people who wanted to do social work supervision. And so it's not intended to be, this is a step-by-step, you must do this. So that's why it's called guidelines, although the actual regulations are included in it of specifically what supervision is and is not and what needs to be included. So did anyone have a chance to read through that? I know you only got this final copy yesterday. So I'm thinking that we might want to continue this for the next meeting, to give you all a chance to really read through that and see if there's any questions or anything that you would add. Who here has done supervision? I think you have, Eric, right? Anybody else? Okay. And I don't know if any of our other members who aren't with us, and maybe a couple of our new members may have, but we'll continue our discussion of that to the next meetings, to give everyone a chance to really read through that before we discuss it and see if there's any questions or concerns. Is that okay with everybody? Okay. Likewise, our continued discussion of regulation of artificial intelligence. David, I think you said you had a point about that you wanted to make.
Yeah, I just wanted to bring a couple updates to the advisory committee. I did have a conversation with a couple representatives from the Information Network of Kansas, Inc., and that is an organization that provides services to different state agencies. They helped us design our payment portal on the website. They held a little forum looking at what they could possibly offer state agencies in the future. And while it's not complete yet, they were discussing the possibility of incorporating AI into tools that could help with state agencies. Some of the things that they were thinking about were pretty low level, in my opinion, use of AI, but practical things. For example, they talked about all the different FAQ section on agencies' websites and potentially taking that information and making it into a chat bot. That would be a bit more interactive if someone came to your website and wanted to interact with the chat bot to learn certain information. I've heard of some agencies using chatbot as a way to get away from answering the phone or public service, and we definitely wouldn't want to do that approach. But if there are new ways of getting information out there, I don't see anything wrong with that. And so we had a conversation. It's still very preliminary. They haven't actually started building things that would use AI, but it was more of they wanted to identify needs for state agencies and issues, and as they consider new tools to build in the future. So nice to know that people are having those conversations, but we're still a little ways off for any kind of tool that we could use with that. The other item I wanted to make you aware of, we've been going through this and having conversations about artificial intelligence, becoming educated on this topic, learning what other states are doing. I wanted to make you aware that there is some federal legislation, and I'm definitely not an expert in tracking some of this at the federal level, but there was a House bill, from what I understand, that included a provision that if it was enacted by Congress, went into law, it would prohibit states from being able to regulate artificial intelligence for, I believe, 10 years. And I'm a little unsure about how wide spanning that restriction would be. But if it is that broad, that would limit, for example, our ability to regulate artificial intelligence as well, to my understanding. So just wanted to make you aware that as we're tracking information at the state level, there's also things at the federal level that could complicate things. If there was a restriction on our ability to regulate artificial intelligence, I feel like, it's still worthy for us to be educating ourselves, following the news, and learning about this topic in preparations for making recommendations to the board. But if there are things at a federal level that would complicate our ability to do that, I will keep you informed and let you know. So just kind of wanted to highlight those bits of news for you all.
Yeah, I believe that provision is in the big bill that is currently sits with the Senate, was passed by the House and currently sits with the Senate. So the idea of 10 years of non-regulation, if we've been talking about how quickly AI has advanced and how quickly it's sort of become pervasive in throughout all of our processes. And if there were 10 years with no ability to regulate or put any parameters around that, I certainly would be concerned about what after, even if after 10 years you were able to regulate at that point, uh, where would it be in 10 years? I would be very concerned about it, how out of control it might be. But we'll just have to track that and see if it's going to affect us. What you and I talked about briefly, David, was that even if we don't have any ability to make a recommendation to regulate, we can at least be making recommendations for best practices and circulate that information as we may develop it. And there are, a number of CE courses that you can take now. I know NetCE had several, and I took one through KU, and so it certainly is something I encourage all of us to continue to use some of your CEs that you need to get to educate yourself about what's happening with AI and how it may impact our practice as social workers. Okay, new business. We are going to talk about a possible new survey of licensees. David, you can explain about, we were kind of the trailblazers in doing our survey a year and a half ago, and all of the other professions then have since done a survey. And as a result of the questions that they asked on their surveys, we're thinking that it would be a good idea to do an additional survey of our social workers so that David can put all that data, together across the board so we can see the answers for all the professions across the board that the BSRB regulates. You want to tell us about that, David?
Yeah, thank you for setting that up so well. You're exactly right. The social workers, we've done surveys for the social work profession a couple times over the years, and most recently we had one in January of 2024. And so, sort of inspired by the social work survey, we said, well, let's talk to the other professions and see if it'd be helpful for them to have surveys as well. And in discussing a lot of the issues with the advisory committees, there tended to be some popular questions that took shape. And so when we released those surveys, we were able to have uniformity in terms of a lot of different topics. And then we were able to collect information from the other professions. And part of this was looking at the mission of the board, public protection, and some questions that were specifically going towards, have you seen any issues out with people practicing in the field that appear to need more training and education? Did you see any issues as it relates to telehealth or supervision? And even going, directly to, are there ways in which the BSRB could better protect the public in terms of the board's mission? And but there was also sort of has been an ongoing discussion and an opportunity for us all to become more informed about the changing work demographics of individuals. You know, in the past, it was one person as a body who lives in this state and works 40 hours. But with the prevalence of remote work and telehealth, that is changing. And you also have individuals who travel and go in different states and provide services, sometimes in Kansas, sometimes in other states, or individuals, you know, working part-time. There are some people who may have stopped providing services directly to clients, but may spend time doing supervision. And so we're wanting to better understand the changing demographics, and then also look to the future to see, you know, what are these professions going to look like in 5 years. And so we were putting this information together and we collected it. And what we were planning to do originally was to have a nice report for each of the professions and then have a comparative report across the profession. But we really wanted to include information from social workers as well. And I realized that there was just recently a different survey for social workers in January of 2024. But some of that information was relevant at the time because there was a proposal for the social work multi-state compact at the time. And so we got some good information about that. We also asked some information about where practitioners are regionally. And so I think this survey could focus on different issues, but once we collect this information, we would be able to have a comparative report, including all 7 professions by the BSRB. So I thought maybe I would just pull up my screen and share it here and just show you some of the questions. We do want to probably stick pretty closely to this language because that would allow us to have uniformity across the professions for the comparative report. But here are some of the questions for the survey based on the survey questions from other practitioners and other professions. So these survey questions would ask individuals, do you primarily work in public practice, private practice, educational setting, or another setting? How many years have you practiced as a social worker between Kansas and other states? Do you maintain an active license but no longer work as a social worker? If so, please explain why you're not currently providing services. And in part of that is we have information as far as our licensees, but we know that sometimes as individuals get advanced degrees or advanced levels of licensing, they may be attractive to individuals in other fields that would want to hire someone to come in and provide, let's say, oversight or administrative type work. And so we want to understand how many individuals currently keep an active license but don't provide what would be considered traditional direct services to clients. And so there's a question about that. We're also looking at the blend between, in a typical week, how many hours do you provide in-person services to clients? How many hours do you provide telehealth or remote services to clients? How many hours are you responsible for supervising, managing, and overseeing the work of others? And then we have tiered licensure for our social work profession, similar to how we have it for other professions. But we want to understand the individuals who, let's say, have held a bachelor's level social work license for several years. Are they actively taking steps towards an LMSW license? And if they are not, we would like to better understand why they made that decision. For the individuals who are at an LMSW and have stayed there for several years, we want to know, are you actively taking steps to obtain a clinical level license? And if you're not, we'd like to know why individuals made that decision. And so we'd like to collect some information on that. We would also like to know, are individuals anticipating retiring from the social work profession in the next 5 years? That would help us do some forecasting and looking into the future in terms of the changing workforce. And then we have a question on here that we asked other professions, which highlights the work of the advisory committee and ask individuals if they are familiar with the work of the advisory committee. That'll be helpful for us as we continue to be more proactive in reaching out to individuals and letting them know that, the advisory committee is meeting often, talking about these important topics, and we'd like to expand the conversation with different associations and students and other groups. We want to highlight the work of the advisory committee and see the level of awareness for people in terms of the advisory committee work right now. And then we have some questions that are open-ended that we can collect some good information, such as over the last 2 years, based on your observations and experience practicing in the social work profession, could you share information on any practice-related negative issues you've seen, such as areas where practitioners appear to need more continuing education or training in a certain area? Over the last 2 years, have you experienced any issues with telehealth, either through professional practice or observations of other practitioners? How many individuals do you currently provide supervision to? Over the past 2 years, have you experienced any negative issues involving supervision? Do you currently use artificial intelligence in your practice? If you do, what areas do you use it? And then, as I mentioned earlier, sort of a direct to the heart of the matter in terms of the role of the BSRB, based on your experience with the licensee in Kansas, do you have any recommendations on additional ways the BSRB could protect and serve consumers of services offered by BSRB licensees? And then a catch-all question, do you have any other comments or feedback you think would be helpful for the members of the advisory committee to receive when evaluating possible recommendations for changes to the statutes and regulations for the social work profession? And just to give you an idea, for the other professions, we asked very similar questions. There were a few unique questions, based on the different professions, but we were able to collect information kind of across the board at around a 25% response rate. Some professions had higher, some had lower, but we were able to hold this survey open for about a month and send some targeted reminders. We were able to set it up so it was an anonymous survey, so we didn't know who had provided which responses, but we were also able to follow up with individuals and make sure that they had an opportunity to complete the survey. And we were rewarded. A lot of licensees gave really thoughtful answers and provided really good information in response to the survey. So in talking with Cynthia and Andrea, I think we really do want to make sure that we have responses from all 7 professions. Even though we are balancing, we don't want to be contacting and asking social workers for information too frequently, but I think given that it's been about a year and a half since the last survey and the value of having this information, I think it would be a good idea for us to release this survey. So that is our current plan, but I wanted to run it by you and then see if you had any questions about the survey being sent out to licensees.
Anyone have a thought about the survey and the specific questions that we want to ask in order to align with the surveys and the other professions? Anything additional that you think we should include in this survey?
This is Lee. It sounds good to me. I think it's covered.
Okay.
Well, we will plan on sending this out, and we will send a message first from the BSRB inbox, and then we will use our survey tool to make sure that it goes out to all social work licensees. But we're really excited about it. So we will probably promote it, and then once we have that information, it should be really nice. If you would like to see sort of an example of these types of reports on the website, you should be able to see draft reports for the other 6 professions. And so if you go to those, go to our website and look for the information from the meetings from April, you should be able to see some of the draft reports for the other professions. And some of them are lengthy, but what we've done is we've organized the results of these surveys a little bit differently. So the reports are more focused on summary information. And so while we did include the actual responses from individuals as appendices to the back of the reports, we really tried to focus on making sure people didn't get lost. One of these I think was 113 pages, but it was really the first 15 to 20 pages that were the summary responses. But then if individuals wanted to dig a little bit deeper, we wanted to provide that information too. So as we're doing more of this research and more of this data collection, we're learning new skills. And so we want to improve this process too. So I think if you look back at our past survey reports, this will be an even better report. And so be on the lookout. We'll try to launch this sometime in the next couple of weeks. And Cynthia, sorry, I went ahead and muted you. So you might have to unmute.
There we go. Thank you for that. Okay, I think this will be a good additional data for social work workforce and very much in line with what we heard at the ASWB meeting in terms of the data they're collecting nationally.
You're right. Yeah, there's kind of a call for data collection, especially as it relates to workforce. And you may be, thinking about these questions and thinking, does the BSRB have jurisdiction over all of these items, and can we actually fix all these items when we learn about this information? And what I didn't mention earlier is that some of these things can help drive the work of the board and the advisory committee in future years, but some of it is also going to help us start new conversations with other groups, that if we don't have this under our authority and we can't solve these issues, we can at least talk to someone else and pass the information to them, and maybe they can carry that forward. So I think we're all trying to work together on solutions, so that'll help too.
Okay. Right. Thank you. Okay, we have talked before about the idea of a jurisprudence exam, which some states have for their licensees, and there was, I think, some consensus that a required exam might not be the best way to convey this information and encourage people to know about the jurisprudence in Kansas. So David had a great idea to come up with a voluntary jurisprudence quiz kind of, or uh, that would teach the jurisprudence issues that we want our licensees to know. And I think we talked about possibly getting a CE for that, or having some kind of a carrot for licensees to voluntarily take this short course. So David, you want to tell us some more about where that project is?
Sure. Yes, and I think we're at the place to where we can actually start building this process. And like you described, Cynthia, this was our approach as an alternative to the traditional model for jurisprudence. We do value everyone knowing this information, and we unfortunately do see some complaints that come in when it appears that licensees or applicants don't fully understand some of the laws in Kansas. We want to make sure that we're helping people better understand the law and avoid any kind of disciplinary complaints. But also, some of this goes towards, requirements for the renewal process and other things that would just make those cleaner and an easier process for everyone. So as opposed to making it a required examination for a fee, we're going to offer it for free through a series of quarterly webinars. And what I've done so far is I've talked to our investigators and also other staff members and tried to identify a list of topics for certain questions. What I'm looking for now is one or two members of the advisory committee that would have half an hour to an hour once a month that we could brainstorm some language for questions. That as we're building these webinars, we want to go ahead and include some language around these topics that would make these questions helpful for social workers when they're taking these. And so some of these would be for licensees and some of these would be for students, but I'm trying to bring in members of the advisory committee just on a voluntary basis to assist with some of the question writing for these jurisprudence topics. So I thought I would just kind of frame that for all of you and see if there might be a member or two of the advisory committee that would be interested in volunteering in terms of putting together the questions for this jurisprudence exercise. And I realize we're down a few members today. So
we're short, yeah.
Maybe what would be helpful in this situation is I could send an email after the meeting to the members of the committee and just kind of explain this item, and then see if any of the members would like to volunteer by just sending me an email back. That might be a way that we can kind of let everyone kind of know about it and then see if they want to assist.
I think that's wise given our small numbers today.
Okay, then I'll plan to do that. We still need to do a little bit of the work in terms of, like I said, the question writing and then making sure that we have the right software to use for that. But I think once we can put this together, it'll be a really nice tool for people to become more informed. And I think people will hopefully enjoy the experience as well. I think, this is not a concept that is being done in any other state that I'm aware of, but I'm really excited about it as sort of a different approach to making sure people are more informed and that they're knowledgeable about the requirements here in Kansas, and that we have less complaints about issues that we can address on the front end. So really looking forward to building this, but I think we're getting close. And so I'll send that message out and see if there's a couple of volunteers who might want to help with that.
David, when the interstate compact goes live, then some people who have an interstate license, will there need to be a separate jurisprudence quiz or course for the interstate compact rules?
So the compact says if you have an existing requirement and people want to practice in your state, you can require them to take your jurisprudence and pass your jurisprudence exam. So that is sort of separate from, you no longer need to have a license in every state, but the jurisprudence topic was carved out. So if there is a state that has a jurisprudence requirement, you would need to do it.
So
Under
if
this,
somebody who got an interstate compact license in another state
Mhm.
wanted to practice in Kansas and we had a requirement of, instead of this being voluntary, we could require that person to take our jurisprudence. But I'm talking about the rules of the compact, which may be separate from each state's rules.
Correct. Yeah.
So would there need to be a separate jurisprudence test or voluntary course for people to know the interstate compact rules? Because every licensee has to check off that they have read and understand all the regs, but we know from the complaints that we get that obviously there's a lot of licensees that don't know those rules
Mhm.
and probably haven't even read them, but certainly don't have them memorized. And now there's going to be a whole additional set of rules if you get an interstate compact license.
Yeah, and there's not going to be a multi-state version of the jurisprudence exam. If a state does require it, you would need to do that in that state. But in terms of the rules of the multi-state compact, they haven't really talked about design anything like that. But I think you bring up a good point. One of the things, while the compact will provide a lot easier access to practice in different states, I think licensees will definitely want to be mindful that every state has the authority to develop unprofessional conduct standards. And while we have those in Kansas, they don't mirror what we have in other states because every state has gone through that process separately. And so it's kind of like when you're driving through different states, there may be laws in another state that you were not aware of, but you are still required when you are driving through that state to follow the law.
Observe them, right?
Exactly.
So getting an interstate compact license doesn't mean that you can just do whatever you do in your home state in any of the other states. You have to, you would be held accountable to know what their jurisprudence rules are.
Yeah, and it will bring up
Not
some
so simple.
conflicts of laws. I think individuals may benefit from having some guidance from legal counsel from time to time. That's up to them. But I think one tricky thing is when you are practicing telehealth, there is sometimes a conversation of if you are in Kansas providing telehealth services into another state, which state's laws do you have to follow? Well, you really do need to.
Client.
Yeah, and you look to where the client's located, but there are some states that would require you to both, be licensed where the practitioner is located and the client. We look to the location of the client, so that's where Kansas falls. But some states have different requirements, so that's kind of one of the nice benefits of the compact is that you have greater ability to practice telehealth through other compact states. But I think in terms of knowing, what are the standards as far as unprofessional conduct goes, I think people want to be educating themselves on those. And I think if we can get more proactive at helping people understand what are the laws in Kansas, that'll be nice when we have a lot more people practicing into Kansas through this compact.
Right. Yeah. Okay, that's great. Well, I think hopefully we'll have a couple of folks that are willing to work on that with you and create a tool that can be a positive instead of, and I would think that it would be a risk management tool that would be endorsed by most practitioners' legal counsels, that anything that you do to educate yourself about the rules is a risk management tool. So hopefully it can be billed that way as well as get the CE or whatever the other benefit that we come up with for them. Okay, so that was the old and new business. We were going to recognize our departing advisory committee members, but they're not with us today. But they are Sarah Behrens and Catherine Reck, and they have both served 2 terms, 2-year terms. And was it Catherine that had moved to Oregon?
I believe so.
Okay.
Yes.
And then Sarah that said she just had too much on her plate and wasn't able to give the time and attention necessary to serve on the committee. But we certainly thank them, even in their absence, for their 4 years of service on the Social Work Advisory Committee. Does anyone have any questions or comments? We're actually going to, it looks like, be able to finish a little early today. But I would ask everyone to take a look at the clinical social work supervision guidelines so that we can discuss those at our next meeting, and look for the survey sometime before our next meeting, which, as it is now scheduled, will be on Tuesday, August 12th at 10 a.m. Any comments or questions?
Thank you, Cynthia. I am surprised we made it through all of that material. Holy cow.
Me too. Me too. I'm glad that we did. And I think, David, you will notify the 2 members that we selected, or we have to go through have David appoint them. So that'll happen. We'll make that recommendation at our next board meeting.
Right. Yeah. The next step is I'll draft sort of a summary of today, and then I'll provide it to you and Andrea so you can take a look at that letter, make sure it actually accurately reflects kind of the recommendations. And then once you sign off on that letter, I'll provide it to the board chair, David Anderson, and then he has the authority to appoint individuals at board meetings. And so the next full board meeting, I believe, is July 28th. And so he'll be able to ask any questions in between then. And then if there's no questions he has, then he can appoint those members of the committee at the board meeting. And then that's usually when I reach out to the advisory committee members once it's all official and let them know they've been appointed. Here's the next meeting, and then try to see if they have any questions about membership.
So we should hopefully have those new members with us at our August meeting.
I think so.
Okay.
Yeah.
That'll be great. Okay. Thank you all. Have a great rest of your day.
Thanks, everyone.
Take care. Bye-bye.
Do we need a motion to end? Right.
Oh, yes. Sorry.
Oh, yeah, we got to do that.
No,
I motioned to end the meeting.
And do I have a second?
Actually, sorry, Cynthia, we lack quorum, so we can't really.
Oh, we can't vote anyway. So
we're doing good. All right.
Executive decision to end the meeting. Okay. I guess we can't vote on that next time after the fact, right? But we can posthumously approve the agenda and the minutes at our next meeting.
Well, the agenda really doesn't need an official approval, but that's a choice. And so the minutes we could take care of in the next meeting.
Okay.
But we were able to get sufficient members to have quorum for the recommendations on new members, so we can move forward with that one. So.
Okay, great. All right. Thanks a lot. Everybody have a great day. Bye-bye.